Hello everyone, my name is Dr. Safira from Nursing Department, Nursing Classy 2019. Today, in this video, I would like to share you about swallowing problem after stroke. Here we go. Firstly, let's talk about swallowing. Swallowing is a complicated task that needs your brain to coordinate many different muscles. If your stroke damages the part of your brain that does this, then this will affect your ability to swallow. Swallowing problems are also known as dysphagia. There are several stages to swallowing. 1. You see and smell food and put it in your mouth. You then prepare it for swallowing by chewing and moving it around your mouth. 2. Your tongue moves the food and drink to the back of your mouth. 3. The food or drink moves through your throat to your food pipe or esophagus, which carries food to your stomach. At the point of swallowing, a flap in your throat, the epiglottis, moves to close over to protect your airway. This stops any food from going into your lungs. 4. The muscles in your esophagus squeeze in wave from top to the bottom, moving the food down into your stomach. Signs of swallowing problems. 1. Choking or choking when you are eating or drinking. 2. Bringing food back up, sometimes through your nose. 3. Food or drink going down the wrong way. 4. Feeling that food is stuck in your throat. 5. Not being able to keep food or drink in your mouth. 6. Still having food or drink left in your mouth after you have swallowed. 7. Not being able to chew food properly. 8. A croaky or wet sounding voice. 9. Dribbling. 10. Taking a long time to swallow or finish a meal. 11. Having to swallow a lot to clear your throat or loudly clearing your throat. 12. Being short of breath when you are swallowing. If you asked me, will my swallowing get better? Yes, of course, you will get better soon. And most people are able to swallow safely again within the first few weeks. A small number of people have problems that last longer than this. Only a very small number of people are left with lasting difficulties. Even if you are left with permanent difficulties, they don't have to stop you from doing what you want to do. But it may take some time to adjust to the changes that you need to make. Are there any treatment that can help? Yes, there are. If you have problem with your swallowing, you should be referred to speech and language therapists. Your speech and language therapist will complete an assessment with you to work out exactly what's going on. Once they know this, they will be able to talk to you and your family about the best way to treat or manage your swallowing difficulties. It is important that you don't eat or drink anything until your swallowing has been checked. To begin with, the most important thing will be making sure that you can swallow safely. If you are not swallowing safely, it could cause infection or mean that you are not getting enough food or fluid into your body. Your speech and language therapist will explain the different things you can do. This could include 1. Changing your diet. If you can't swallow safely, then you will probably need to make changes to your diet until you can, with advice from speech and language therapists. 2. Learning techniques that can help you to swallow. 3. Using aids that can help you to eat or drink more easily. As well as this, your speech and language therapist may also get you to practice exercises. Strengthening the muscle in your face, tongue, lips, and mouth may help you to swallow better. So, what can I do about this swallowing problem? You can do 1. Listen to your therapist. The most important thing for you to do is to follow the advice that your speech and language therapist gives you. Even though you may think that you are able to swallow safely, you can't know for sure. 2. Ask questions. It's important that you understand the instruction and advice you're given. So, ask your speech and language therapist to explain things again if you need them to. 3. Learn how to swallow safely from your speech and language therapist. 4. Look after your mouth and teeth. If you don't clean your teeth and mouth, then bacteria will build up around them. This can make your mouth sore and lead to infection. 5. Talk to someone about it. Swallowing problem can be especially difficult to cope with at home. A large part of our family and social life is about eating and drinking. So, it can have a big impact when you are not able to enjoy these things anymore. Many stroke survivors feel left out when they are not able to take part in family meals time. Sometimes it can be difficult to know how to help someone with swallowing problems. So, here are some tips to help you. 1. Always check. It's difficult to know what helps and what doesn't when it comes to swallowing. 2. Give them time and privacy. Swallowing problems can make people feel very self-conscious. So, make sure your friend or family member has some privacy when they are eating. 3. Ask for help if you need it. Coping with swallowing problem can feel very overwhelmed, so don't be afraid to ask for help. Before your friend or family member is discharged from hospital, make sure you know who you can contact if you have a question once they are home. 4. Don't ignore advice. The best way to help your friend or family member is to make sure they stick to the advice they are given. That's all my video about swallowing problem after stroke. I hope this video can be useful for you. Goodbye and see you in the next video. Wassalamualaikum warahmatullahi wabarakatuh.